But what about the argument about exposing women to the radiation?
Indeed, there is some exposure radiation.
And so there are some who argue, who say, hey, going every other year helps to deter this.
What isn't mentioned is that we have gotten a lot better in our ability to use less radiation. So it's important for women to understand that. Additionally, there are other techniques also available. So if indeed that's a concern, you could certainly talk with your provider who could help you determine if indeed there were an alternate that would be appropriate for you.
But let's talk about those who do not have providers. Then what?
Right.
That's a problem.
In the state of Illinois, and you make a good point, if a woman needs to get a mammogram, the American Cancer Society can get you connected to places that can give you a low cost or no cost mammogram in the state of Illinois.
Right. What a lot of women may not realize is the state of Illinois has the Illinois Breast and Cervical Cancer Program. And any woman that wants a mammogram can call and get information, and it will be covered. Whether they have the ability to pay or not. So the services are available and they are paid for, and should they need further care and evaluation, there are resources available for that to be done. I think what Mary raises a really important point, and that's the context of people having a provider. Now, many may not, but we're blessed in Chicago to have a number of clinics, federally qualified health centers, the health department clinics, where no woman should go without medical care if they need it, and I'm talking about primary care. Everyone should have access to primary care. And I think what really is important is that people should have a patient-centered medical home. And what concerns me about these guidelines is this create a lot of confusion among consumers, and they don't know who to talk to, which tells me that they don't have the types of relationships they should have with a medical care provider. If they were comfortable with their doctor, then they would be able to go in and say, I've heard about these new guidelines, what do they mean for me, and what should I do? And I think that's what Mary is getting at. I mean, people should have a relationship with someone in the medical field so that they could go up and say, I don't understand this.
But
I need
should
help.
have resources, just resources for our community of women that don't know where to go. Some don't have providers, some don't have doctors. But they should have, we should have this information, get this information out here. I took a young woman to the breast and cervical cancer examining, I'm sorry, the name of it escapes me.
Breast and Cervical Cancer
Program. I took a woman to that program. She had no income and no insurance. Took her there. They gave her a pap smear. They gave her an ultrasound and a mammogram, free of charge.
And we have 5 clinics
She did
that all
not have to
participate
wait.
in
We
the
were
program.
in the hospital at Mercy Hospital. We were in the hospital. This has just happened 3 weeks ago. We were in the hospital probably 3 hours at the most. Got an appointment for her, and that's another thing. Mammograms are backed up. So we got an appointment for her in record time, took her over there. I stayed with her the entire time. They gave her screenings because she was in fear that she had breast cancer. Her mom had died at 56 of breast cancer. Her sister had died at 28 of breast cancer. And she was told 2 years ago that she could have it. She freaked out and never went and did any follow-up.
But that put her in a higher risk.
High risk, absolutely.
And that is not the group of women that we are talking about that would be impacted by these guidelines. Though having support was certainly critical.
Absolutely.
And
that's basically my point here.
The guidelines do spell out the context of a high risk.
Well, they don't spell out context, but they allude to context. And for me, context means that some women are at increased risk of breast cancer.
Absolutely.
And that means that there's certain groups of women that should look at these and say that this may not apply to me.
And that group of women would need to talk with their provider. And if they don't have one, they can always call the American Cancer Society. And that number is available 24 hours a day, 7 days a week. It's 1-800-ACS-2345. The other thing that I think is important, and Adele, you mentioned it, that you found your own lump.
Absolutely.
Women should know and be familiar with their own bodies. And that's important. And if you haven't had a clinical breast exam, have your provider take care of that for you. Review the techniques so that you are empowered and not fearful.
Because I must tell you, let me just say, I must tell you, I always wondered whether I would be able to tell the difference in a lump if I found one, because when most of us have lumpy breasts.
You know, and explain this, because women do their self-exams, and there have been instances, and this is why I'm getting at, because I really want to stress, I understand what you're saying about doing self-exams and how important it is. And so what I want to get at is this, is that the ability to distinguish between something being a normal lump, quote unquote, and then what's considered to be.
We have dense breasts, we have fibroid breast, we have lumpy breasts, lumps in our breasts. But when I found my tumor, it was hard as a brick. I knew the difference immediately. I knew that there was something different about this, and I think you will know.
You will know.
Yes.
And I think that the point that Mary makes is very important. That people, and women specifically, need to know and be in tune with their body.
Yes.
Whether they do it correctly or not is not as important as being familiar with your body, what changes are taking place. So I would encourage women to continue to do self-breast exam, because it's one way for them to be in touch with their bodies.
And it's funny you should say that, because I know I do the exams, and of course you do the exam and you're immediately paranoid. You start calling your doctor. And that's what
That's what doctors are for.
And that's what my doctor said. My doctor's like, you know,
That's
you
why
can
they
call
get
me,
their training.
you can call me every other month saying what you felt, and you know. But it's just the fact that you are doing it and you are talking to the doctor, getting that feedback. So I agree with that. But let me ask you this, Adele, as a breast cancer survivor, how do you feel? How do you interpret these new guidelines?
I think these guidelines discourage women from seeking their screenings. I think it's a little reckless. It kind of, you know, puts a woman in a mindset, if she has fears, she's not going to do it. If she doesn't have resources, she's not going to go and seek resources out, because they're discouraging. They really are discouraging. I am so against them and so upset. Even the notion, even putting that information out, it's just, it's just not good. It's not good for women.
How much harder does this make, you know, your organization's job to get the information out about breast cancer? Is this making it harder?
I think the American Cancer Society has recommitted itself to being sure that women understand our recommendations have not changed, and there's no scientific evidence to lead us to make a change. So again, we encourage women beginning at age 40 and annually, and if you have questions, give us a call, talk with your own provider.
And if you have high risk, perhaps younger than 40, earlier than 40.
Right, I think what's happened is it creates a lot of confusion, and as you were pointing out, it probably provides or provokes a lot of stress in people, because now they don't know what to do. Should I get a mammogram? Should I not get a mammogram? And particularly if they don't know who they should turn to or talk to. I mean, it's a very real problem. But the American Cancer Society has been consistent, and they have not changed their recommendations moving forward.
Absolutely.
And so I would say that women should continue doing what they're doing and should not make a change. They should do what they're comfortable with. These guidelines were...
But those that aren't doing anything, they especially need to step up their game and start doing
Well,
something.
those that are not, they need to step up.
So they don't need any discouragement.
Right.
I think with just listening to everybody, that one thing that seems to be low is the communication between women and their providers, and then the absence of a provider. So, you know, those are two issues that definitely need to be addressed somehow, some way, and I do believe, Mary, your organization can play a key role, probably already is, and all that. I'm sure of that. But if more women take the initiative to get in touch with their bodies, like, you know, we all are discussing here, and also to reach out to your physician, because you made an excellent point. You know, when you did your self-breast exam and then you thought maybe something, wasn't sure, and you called your doctor. You know, a lot of people may, you know, be more reformed not to, but they should be able to, because that's what your insurance is paying for. And even if you don't have insurance, there are other places that you can get in contact with. You've noted a couple of them, more than one, in different areas. And I think that that's very important and prominent in this issue.
But Joe, with the Department of Health for the City of Chicago,